Hi there. I'm State Representative Laurie Jinkins from the 27th Legislative District, which includes the heart of Tacoma. I'm coming to you from our state capitol in Olympia, where I've been attending meetings all morning. As most of you know, the legislature is in the middle of a second special session to pass our new two-year budget for our state. It's a process that requires negotiation and compromise because control of the legislature is divided. Democrats have the majority in the House and Republicans have the majority in the Senate. Both the House and Senate released budget proposals earlier this year that include increased funding for our K-12 public schools. While both proposals include new revenue, the approaches are very different, and that's what needs to be negotiated. Unfortunately, for 5 months now, Senate Republicans have refused to join House Democrats at the negotiating table, and that's meant not one but two special sessions so far. Time is running out. If a budget compromise isn't reached by June 30th, there will be a state government shutdown. That's because the current fiscal period ends June 30th, and by state law, we can't spend money without a new budget in place. While I remain hopeful an agreement will be reached by this deadline, I want to be candid about what the citizens of our state will experience if a shutdown of government occurs. I'm someone who works in the field of public health when I'm not working as a legislator, and I'm confronted right now by the realities of this possible shutdown. Here's what it would look like for public health. Our local Tacoma-Pierce County Health Department would immediately have to temporarily lay off 42 staff members across 14 programs. These are critical frontline positions, including public health nurses. The affected programs include public health emergency preparedness and response, home visiting services, maternal and child health, and even STD and HIV disease investigations. In fact, the department's ability to investigate sexually transmitted disease cases in our area would be cut in half. This means people with diseases like gonorrhea, syphilis, and chlamydia and their partners wouldn't be tested and wouldn't be treated. The consequences for the public and for public health are potentially devastating. All told, losing state funding would mean a reduction of $8 million, or 23% of the health department's 2017 budget. While these cuts are harmful to the health of people in our community, they're also really harmful to our economy. That's because some programs critical to business fall under the umbrella of public health. For example, shellfish growers in our state are making plans to harvest early because they won't be able to sell what they harvest during a state government shutdown. Without shellfish inspectors, which are a function of public health departments, these growers can't sell their goods to the public. These are just some examples of how harmful a shutdown would be for our state. I'm hoping we don't get to that point because these negative consequences would affect everyone from both sides of the aisle in all communities, urban and rural, east and west of the Cascades. That's why I'm down in Olympia nearly every day trying to help craft a budget compromise. There's still time for everyone to come to the table and work out a compromise. My hope is that it will happen soon. I hope to have better news for you in the next update. If you do have concerns or questions about the state budget or a potential government shutdown, please don't hesitate to contact me. My contact info is on your screen right now. Thanks for watching. It's an honor to serve as your state representative.